60 Minutes Overtime.
This week on 60 Minutes, we report on maternal health care in the wake of the Supreme Court overturning Roe v. Wade. We began our reporting in Texas, the first state to change its abortion laws. We found that the new laws were negatively impacting doctors practicing in Texas and the med students and OBGYN residents looking to learn there. What were you not learning in Texas that you needed to learn?
I'm pretty sure in our women's health chapter, it said abortion is a complication of pregnancy, period. That was it. So we were missing everything. And when we asked for it in our curriculum, they're like, oh, well, it's a state-funded school, and since the state doesn't support it, then we probably shouldn't teach it.
In 2021, Danny Matheson was a med student in Texas with a goal of becoming an OBGYN. She discovered that education on anything to do with abortion was so limited that she and her fellow students had to teach themselves.
There's a fear to even discuss it. So we would meet after hours we would rent out a classroom and bring in abortion providers, and they would teach us and practice on papayas and dragon fruit.
You were practicing on fruit?
Yeah, it's actually really common. It's a really great model for a uterus.
Pregnancy could be life-threatening in some cases, and the fact that the state could force you to continue on in that emergency, it's crazy to me.
Dr. Adrien Smith is an OBGYN resident.
You're okay?
She began her residency in Texas, but transferred to a hospital in New Mexico. Like Danny, she was seeing how the abortion laws were impacting her education. Smith says limits on education lead to restrictions on care, and not just in pregnancy.
We're seeing now with these new restrictions, more OBGYNs are leaving these states. You need OBGYNs for pap smears, for birth control, for mammograms, and then not to mention routine pregnancy care. You need OBGYNs staffing the hospitals and staffing those labor and deliveries, which in rural areas are already struggling to stay open. And so people are having to travel further for care, pregnancy or other care, and then waiting even longer to be able to be seen.
These vacancies are contributing to what a recent report by the March of Dimes calls a maternity care access crisis. That means there is no birthing facility or obstetric clinician available in the area, impacting more than 2.3 million women of reproductive age.
Come on up.
We've seen people leave states. We know we have maternal care deserts around the country that are being worsened by people leaving.
Dr. Stella Dantis is the president of the American College of Obstetricians and Gynecologists.
For example, in Idaho, one study said about 25% of physicians have left that state, and that's a state that doesn't have a lot of OBGYNs to begin with. And then we're also seeing the effects on training. So when a medical student is applying to train for residency, they're now looking at residency programs and asking questions. What is the abortion training I'm going to get there? Am I going to get enough training to come out and feel competent and confident to practice the field that I desire?
In Texas right now, we know that residents can't get that training. Do you need to have that training to practice as an OBGYN?
Well, yes, because abortion is reproductive health care, and OBGYNs are the people that provide reproductive health care. Abortion is the same procedure that's used in miscarriage management, ectopic pregnancy management, situations where the pregnancy is highly desired and it cannot go on for the health of the mom. So you do need that training.
These women's health issues are on the ballot of 10 different states this year. What do you want voters to know?
I want voters to know that this is not just about abortion, that this is about legislative interference. You can't legislate how we practice because you can't know every situation.
For Dr. Adrien Smith, the growing gap in women's health care has made her want to practice medicine in a state like Texas or Georgia after she completes her residency.
For me, I do feel passionate about going back to a restricted state.
Why?
Patients need us there. We need OBGYNs in these areas that can provide these procedures and the education and counseling in the cases where we can still do them. And we need the OBGYNs to advocate for changes If no one is there advocating on behalf of these patients, then we may not ever see some of these laws get overturned.